Yes, I am Professor Puddu from the University of Rome, now retired. I am a cardiologist and a PhD, and my main research interests were initially on electrophysiology, then on clinics, and more recently, although I had a long experience on the subject, on cardiovascular epidemiology. And the idea of presenting the last papers, which is the subject of the present interview, came for looking at your journal as a specific journal for review articles. So my interest was related to this, since the paper that we presented review a large experience, and this was the main reason for presenting it. Now, this is a very, very important question and central for explaining and interpreting our results. Now, the 7-country study was a classic in cardiovascular epidemiology. It was initiated in the 50s of last century by Professor Keyes from the University of Minnesota. And the central idea was to compare the situation of different populations, so widespread from Japan to Finland, since the fundamental idea was that diet might have interfered with blood cholesterol, and blood cholesterol might have been the central cause for coronary artery disease. Now, this has been abundantly demonstrated, but what we presented in our paper is that there is a slope relating blood cholesterol and the cardiovascular mortality, which is very similar among different populations. And this is a fundamental aspect, since the 7-country study joined the research on all these populations by exactly the same methodology, namely the same age range of the men enrolled, the same methodology for calculation of blood cholesterol, and all the parameters were stable and stably measured. And this is a main difference in relation to meta-analysis existing on this problem, since there we have different methods, different age ranges, different sexes, and this makes it difficult to make a direct comparison. So the importance of the 7-country study about the central idea that diet might interfere with blood cholesterol and the incidence of coronary artery disease, in parallel with another study, which is Framingham in the States, the central idea was to have different populations. Instead of Framingham, they only have one population in the States. In the 7-country study, we have population from the States, Italy, Northern Europe, and Japan. And the idea was to try to relate diets to blood cholesterol and blood cholesterol to the incidence of coronary artery disease and mortality. And in fact, in this paper, we show clearly that although the absolute risk, as illustrated in our figure 1, is very different, for example, for population at low risk as compared to population at high risk. So this risk is related to the level of blood cholesterol. The less is blood cholesterol, the less the risk, the more the risk. So if we separate populations with low cholesterol or high cholesterol, the absolute risk for coronary artery disease is much different. But if we relate the risk relative, so the difference between 200 and 220 in both conditions, the risk is identical. And why is that? Is that since the slope relating blood cholesterol to absolute risk are identical. And the figure shows that you have two parallel lines, two relations in parallel, only displaced in absolute terms. So the average in low risk is 200, the average on high risk is 240 or more. And this is a fundamental aspect of this paper and the important, let's say, a message to be taken by the audience that the absolute risk might be different, but the relative risk is the same. As I have specified previously, the seven-country study was initiated by Professor Keyes, also of the University of Minnesota. And Henry Blackburn was an intimate associate with Professor Keyes and joined the chair of cardiovascular epidemiology when Professor Keyes retired. Now, Professor Keyes retired, but he lived until 102 years. And he continued for sure up to 100 to make research, make analysis, and help all his collaborators. Now, Henry Blackburn, who has been the editor-in-chief of Circulation in a given moment of his career, continued in the same line, but now he is 101. And the last paper that he reviewed and consulted on was particularly this one. So not only we acknowledged his presence as a continuator of the effort of the seven-country study, but also on the fact that Professor Blackburn continued until the age of 100 to help us and to review articles giving suggestions, although he did not wish to be co-author. Clearly, at his age, he had no reason for continuing as a co-author. And what we do now with Professor Menotti, who is 92 years old, and myself 72, is along the same lines. So we continue in this history of making research also at very old ages.